Hi, I am Ali Nisas, registered nurse and managing director of Nice Us Geriatric Home Care Training and Agency Limited, and this is Return the Favor, a web series giving you tips on how to properly care for your elderly parents. They took good care of you as a child, so now it's time to return the favor. Hi, I am Ali Nisas, and you are watching Return the Favor. So we are at episode 14. The episode today is titled Tips on How to Properly Measure Vital Signs. So we would not be going through the actual measuring of vital signs today, but I need to focus on how to properly measure it. Sometimes you may go ahead and try to measure vital signs, and because you didn't measure it properly, you get an incorrect reading. And an incorrect reading can be detrimental. Why? Because a correct measurement will give you a correct diagnosis, will allow you to get correct treatment and the right interventions. All right, so what are vital signs? Vital signs are indicators to your health status. So it is a look on the inside of what is really going on. And it may not be an exact indicator, it may not be cognitive to what is really happening at that time, but it can give you a snapshot of any issues that they may have, any problems, or anything that may be of concern, what is going on with your organs at that time, right? So the main vital signs is random blood sugar, temperature, pulse, respirations, blood pressure, and your oxygen levels, which we call SpO2, right? So what we're going to do, we're just going to go through how to properly measure each one, tips on how to get the correct measurement. So again, I'm reiterating, we are not going to teach you how to do these vital signs, but more so how to properly measure them, things that will help you get the right measurement. So when you do measure them, it will be an accurate figure and you can give your healthcare provider, or you can mark it down for future reference, right? So why do we measure vital signs? We measure vital signs as a precaution. Sometimes you measure your blood pressure just to make sure that you are not hypertensive, you're not suffering from high blood pressure. You may do it because you're starting a treatment or a program. So you may be starting a fitness program, or you may be starting some kind of treatment that needs to ensure your status, your health status is okay, because it may get very intense and may cause issues maybe on your heart, maybe on your kidneys, who knows. So you need to know that first level, what we call the basal measurement. We need to know that beforehand. Maybe you have to do a health checkup. So you may have an outreach program where they're offering health screening, right? And you need to check up just to be sure, right? It may be a routine check. So you may have been told that you are pre-diabetic or pre-hypertensive. You may be expecting a baby. You're pregnant and you want to make sure that you have routine checkups at your doctor's visit, or when you visit a healthcare center or a health facility. They will check your vital signs so that the doctor will know what is the snapshot of what's going on in your body. So again, he can give you a proper diagnosis. And for persons who have chronic diseases or specific conditions, measuring the vital signs is critical. It must be done on a daily or frequent basis. All right, so let's get into the tips. So for your random blood sugar, you're getting ready to check the blood sugar. You're going to use a finger. So you have to stick one of the fingers. This finger, the forefinger, it's the most painful. The little finger, it is the most delicate, and the thumb finger is the most resilient. So the two fingers in the middle, those are the better fingers to use. It's less painful and it is better to use in order to take sugar. Now, you need to rotate the fingers because checking blood sugar on one finger too often is going to cause some issues with the surface of your finger, right? Also, you can clean your hands before you check your sugar, right? Sometimes when you use the alcohol swab, we know of the alcohol swab, sometimes when you use it before you stick, it can give an incorrect reading because remember, alcohol is sugar. So it can give an incorrect reading. So it's better to wash your hands, then you stick, and when you finish the process, then you can use the alcohol swab. It's a very, very small stick. It's not that large of an incision. So using the alcohol before is not as serious as using it after. But again, this is just tips. I know some persons will start to, but these are just tips in order to get the correct reading, right? And again, if you're doing blood sugar, it's better to check it before meals because when you eat, your sugar increases. So better to check it before meals. If it is required by the doctor, then you will have to check before and after. Always follow your doctor's orders. But if you want the best reading from the sugar, check before meals. All right, now let's go on to temperature. So when you're checking temperature, make sure and take off the AC and the fan. Remember, these things will cool your body down and it wouldn't give you a correct reading. So take off the AC and the fan, right? When you're using either a mercury thermometer or a baby thermometer, one of those baby thermometers or the digital thermometer, make sure it makes contact with the skin, whether it's under the armpit, under the tongue, whether it's rectal, make sure it makes contact with the skin because you wouldn't get a correct reading if it doesn't make contact, right? And for the infrared thermometers, if you're using the infrared thermometers, make sure it's on the right setting. You know, some of those thermometers they measure the environment and they measure humans. So you have to make sure it's on the right setting or else you'll get an incorrect reading. So for pulse, and your pulse is your heart rate. So what tips there? Never take your pulse with your thumb. There's a pulse on your thumb. So if you try to take someone's pulse with your thumb, you're going to get your own pulse. All right? And when you're taking it, let someone sit down for a few minutes or 5 minutes before, because when you move, your heart races, or your heart, it doesn't necessarily have to race, but your heart increases because you're moving and you're walking around. So let them rest for a few minutes and then check the pulse so you can get an accurate reading. And don't squeeze, just feel when you're checking the pulse. So when we're checking the pulse, the wrist is usually a favored area. Don't squeeze down when you are checking the pulse. For respirations, and respirations is the breathing in and out. Don't tell the person you're checking their respirations. Never. Because what they will do. Alright, so I come and say, Mr. John, I'll come to check. You're breathing, right? And they'll be like, okay. They'll start to exaggerate the breathing, right? So try and observe them when they are not really observing you, observing them, right? And then check the respirations. And remember, one rise and fall of the chest is one count. All right? Let's go on to blood pressure. So a lot of people, they check their blood pressure. And there are so many tips that you can incorporate to ensure that the blood pressure is checked correctly. First things first, always make sure they rest, right? Again, with the pulse, the heart increases with activity, with movement. So too does blood pressure. Blood pressure increases with activity or movement. So allow the person to sit down for a few minutes, right? And then check their blood pressure. Make sure they sit up and their feet are flat on the ground, that their back is towards the back of the chair, they're sitting upright, right? If the doctor specifies for you to do the blood pressure lying down, or standing up, that is when you do it in those conditions. But usually you allow the person to sit down, upright, feet flat on the ground, right? Keep the arm at the heart level so you get the most accurate measure of the blood pressure. And if you do it on the left side, you're going to get a more accurate reading than on the right, because even though the heart is in the center of the chest, the tip usually leans to the left. So it's closer to the left side. And the closer you check your blood pressure to the heart, the more accurate that blood pressure would be. So if you check your blood pressure in your foot, it's going to be higher. The further away you check your pressure from your heart, the higher the blood pressure will be, because that pressure needs to be higher in order to return to the heart. So left side, heart level, that is the very most accurate place to get your blood pressure, right? And so don't allow the person to talk, because talking can increase your blood pressure. Yeah, and encourage them to relax, because thinking about things, it could increase your blood pressure. Remember, blood is liquid, and liquid can change its pressure as it flows through your blood vessels. The pressure can alter with temperature. Your blood vessel, it's not fixed. It's not like a fixed pipe. It expands, it gets smaller, it gets larger, it gets, there are a lot of changes that occurs within a split second, right? So when you're checking blood pressure, remember, don't be too alarmed by a very high blood pressure, right? You would want to first measure your blood pressure over a week to make sure that you get the average and not just one snapshot, because when you check a blood pressure, it's like going into the blood and just getting a snap of what is going on there. So if you get a high blood pressure, it may not mean, oh my gosh, I have high blood pressure. Pain increases blood pressure. Stress increases blood pressure. Certain foods, too much sugar, too much salt increases blood pressure. You understand? So don't rely on one reading. If you do your blood pressure, you follow these steps, and you find it is high, then please check your doctor, but also monitor it for a week. Take it the same day, take it the same time of day every day for a week. Take it in the morning, take it in the evening. Do the tips that I just told you about and see on average how your blood pressure reads, right? And if at any point in time you're checking your blood pressure and you get an error code on your machine, or something didn't work out and you need to recheck it, don't just slap on the cuff and do it again. Put your hand in the air and wiggle it, and then put your hand down and wiggle it, probably massage the area, because when you're doing blood pressure, it cuts off circulation, and then releases it slowly. So you want to make sure that you fill back the arm with blood before you check the blood pressure again, so you can get an accurate reading. Yeah. And there's one more thing. I think that's it there. Yeah. All right. So for oxygen levels, how you can best get readings for oxygen levels? Well, if your fingers are cold, you're not going to get a proper reading. So anytime you have on the SpO2 on the finger and you realize nothing is reading, you can massage the finger to get blood flowing in that finger. Yeah. All right. No nail polish. Don't ever have nail polish on your fingers when you're doing the oxygen test. Remove the nail polish. And if the person doesn't have any fingers or toes, because you can use the SpO2 monitor on your fingers or your toes, if those are not available, you can probably clip it on the air and you will get an oxygen level reading. That's for once the machine is advanced enough to pick up that oxygen level. Yeah. So these are just some tips on how to properly measure vital signs. Don't forget to subscribe to get more content like this. And if you want more details on the topic for today, check out the blog on our website. Link in the description. Until next time.